Let's get it on. Level 2 First Aid Kit Review by Nutnfancy. Welcome to Part 2. These are the specifics. I spent a lot of time in Part 1 talking about the philosophy. You've probably seen that. We'll make references as we go along. As you can see, this is the Black Hawk Medic roll, which I've talked to in detail in Part 1. The nice thing is you can see all the contents. This is very advantageous, dudes, because you need to access certain things for certain emergencies, and there's no better way to do it than the clear pouch concept. Now, the Black Hawk Medic roll is not the only container that I would recommend. There's several good ones out there. I covered a couple options for you in Part 1, and here's another one I found, if I can find it fast. Here we go. This is out of the Midway Flyer, and this is a compact competition range bag for $28, $27.50 on sale. I haven't seen this, but this is a good size. You can see the dimensions right there, and something tells me with its 5 pockets, it could be a good level 2 med kit. However, you wouldn't have this open access to be able to see everything. So lots of different containers out there. I think some guys in Part 1 chimed in with some really good comments saying, hey, this is another option you might want to consider. So there's some smart people out there in the comments that know what they're talking about, and it bears listening to them as well. Appreciate the help and the contributions. On this side, and you're going to see as I go through my level 2 kit, I basically jam blood stoppers in every nook and cranny. Blood stoppers would be classified like these 4x4 inch Kindle sponges. Okay, and then I'll get to that other one in a second. Here, these ones are in a plastic bag. And you might say, well, why isn't everything in a plastic bag? Let me talk to that real quick. I've done this level 2 kit business for a long time, and something I have found out is that through its rolling up, multiple use, and again, this is a roll-up medic roll, and so the components are going to experience some type of wear through the years. That's been my experience. Bags are going to crack, they're going to get little holes in them, so it's very tough to keep your med kit 100% waterproof in my experience. I'm speaking from just that, my experience. That's why you see this document envelope, which I covered in my level 1 kit review, talking about that. There's an NSN number on it if you so desire. These are the best plastic bags I've ever found in my life. These are made of Mylar. Be careful, there's another type of document envelope bag out there which is also a mil-spec envelope, but it's made of vinyl. This one is made of Mylar. Much tougher, and it is an outstanding envelope to make your bandages waterproof. However, I can't use it everywhere because it adds thickness and bulk, and unless you take all the air out, it's also going to add, like I just said, bulk. But it is the best that I can find. Now, back to why I don't put it all in there is because I'm really not striving to make this kit 100% waterproof. The reason why is it's exhausting. It's too much to put everything that would be ruined by water in a plastic bag. And as you will see, I've made an attempt to somewhat waterproof it, but that's just kind of where I'm at right now. Remember, it's always a work in progress. I may change, but that's where I am with my level 2 kits. I'm going to have a portion of it absolutely waterproofed, like this document envelope. You see how I just squoze the air out of that? These will be ready to rock and roll. These are quicker accessed. So if I were to go dunking in a stream and actually submerge this kit entirely underwater and leave it there for a number of minutes, no doubt the integrity of this envelope would be compromised and it would no longer be a sterile dressing. You can see it's been wrapped and bent a lot. Again, you're going to have wear and tear in your level 2 kit, at least going with this type of form factor, a roll-up roll. If you go with a tuck-in pouch like I showed you previously on those other med kits, I think your bandages will experience less wear, with perhaps a disadvantage of not being able to see inventory. So absolutely. Have a lot of blood sponges. Okay, let's talk about blood loss. This is harkening back to my video, A First Aid Story. The loss of blood, and again, I'm not the medical expert here, but the loss of blood can kill people quickly. A lot of people will bleed to death when they experience a severe laceration, a severe cut, and when they're surrounded by a lack of immediate medical attention and or people who know how to stop such blood loss, they will die. have a lot of blood sponges, as many as you can fit in your level 2. That's just my recommendation. We're all kind of influenced, aren't we, by our life's experiences? And I will tell you that I was very influenced by that accident that I came upon in the 80s, which I told you about in a story of first aid. Never again do I want to come across an accident like that where I feel inadequate and that I have a capability to save someone's life with blood sponges. That being said, this is not a heavy-duty blood sponge. I think of this more as a first aid dressing 4-inch variety. A blood sponge would harken kind of along the line of this, a Topper by Johnson & Johnson dressing sponge. There's also some Surgit Pads that I have in here. This is the kind of things that we can include in our level 2 kit. Johnson & Johnson Surgit Pad. I think I bought these at Walmart, dudes. And they sell them at Walmart because there's a lot of people who have dressings that they have to swap out, maybe post-surgery or something, and they don't always have the insurance to do it for them, so they do it. So that's cool, they carry that. Again, these are expensive. Everything I'm showing you is not cheap, especially if you go with a name brand like Johnson & Johnson. You take it down a notch to maybe a somewhat off-brand like Kendall, maybe something else, maybe when I get to other size gauze pads, Target brand, those are going to be more affordable. But don't expect, you know, for these to be cheap. So these are surgical pads. See how they're thicker? That's going to absorb more blood. Okay, and that's good. Now, in part 1, we talked about application of new medical technology. Remember that? Where did my note go? I don't even know where my note is. I'm just going to shoot from the hip. One of the things that I want to integrate and that I'm researching currently for the stopping of blood and wound dressing is a new product called Polymem. I do believe it's put out by 3M. I could be off on that, but I'm pretty sure, just like 3M makes this Tegaderm, we'll talk about that in a sec, but Polymem is an advanced methodology of treating bleeding and also wound regeneration, if I'm not mistaken. It's a polyurethane foam that will absorb 10 times its weight in blood. Polymem. And it comes, I think, in pink and another color. And I'm having a hard time finding it. I'm sure I will find it. And if I can fit it in my level 2 kit, I will do that. But I think Polymem bears some watching. It is a new technology for blood stopping. Sorry I don't know more about it, but it's not in my kit yet. So it's just something that I'm researching right now, and I will probably include it in the future. Okay, so there's my blood stoppers there. You can see the various sizes I have. More is better. They're kind of bulky though, aren't they? That's going to take up some weight. Now in this bag here, I have some 3-inch sponges. These are kind of just gauze pads. I think of these as blood stoppers, smaller variety, and also wound dressing. And there's a no-name one I have in there as well. You don't have to go with Johnson & Johnson on your level 2 first aid kit materials. You don't. You can go with a no-name if you want, especially when you're talking about something like a gauze pad. However, when you get into a proprietary technology like this Tegaderm, and we're going to talk about that right now, you will have to go with the name brand, unless there's some knockoffs, which if they are, I'm not aware of them yet. Tegaderm, from my understanding, is an awesome bandage technology. Hang on, the battery's dying. Alright, here we go. I think of Tegaderm as kind of Gore-Tex for your wounds. In other words, let's say I get a big old gash on the back of my hand, okay? And I want to protect it. And I'm in the backcountry, okay? Now, in years past, I've protected it with a standard wound closure, kind of like the 3-inch gauze pads you guys just saw, taped up, right? And that'll work. However, it's not waterproof. And it's susceptible to the ingress of infection-causing liquids like water or whatever. So the wound needs to be kept dry. Tegaderm is a technology which allows transpiration through the wound area. Transpiration meaning that vapor can escape, however water cannot penetrate. That's Tegaderm. It's kind of like Gore-Tex for the wound. Very expensive, but it's a really cool technology. Now, I have not used this yet. However, it's included in my level 2 and now in my level 1 because, for me at least, it's a new technology that I've incorporated. And just like I said in part 1, when I find it out and I find that it's something that it bears watching and that really has some value, guess what? I'm going to adopt it. Now, along with Tegaderm, my understanding is when you have your wound, obviously you're going to cleanse it out, maybe flush it with some saline. There's lots of different thoughts of how you're going to clean the wound. But let's say it's cleaned and it's dried. That's when you're going to apply Tegaderm. And my understanding also is you're not going to put anything in it. It's just going to be the wound itself, and then you'll put Tegaderm over the wound. Now, this is a bigger one. You're going to see I have some smaller patches of Tegaderm. This is a larger one, 4 inches by 4 3/4 inches. So this would be a larger wound area. So once it's dried, and then also I'm going to swab the adhesion area with this benzoin, the tincture. And what that will do is promote adhesion of the Tegaderm. Notice here that I put a little label on that. Benzoin, and I don't even know if I'm saying that right, tincture, and that's for skin prep for Tegaderm. Because see this area here in Tegaderm where that's the adhesive portion. See how it's taped on the back side? And no, I'm not going to open one of these up. They're too expensive. But when you peel that backing away and then you've swabbed the clean skin with your benzoin, then you're able to prep the site for the application of Tegaderm. Goes on just like tape, seals nicely, and it bends and flexes with your skin. In fact, it acts just like a skin barrier. Very, very cool. However, it will not allow the generation of scab tissue, is my understanding. So it's kind of a temporary wound closure. A temporary meaning probably a couple days you could wear Tegaderm. And in the backcountry, when you've got a lot going on and there's a lot of opportunities for infection, especially maybe in the jungle, dude, Tegaderm. Bring it, integrate it. I think it's awesome. So there's some really cool technology. So here you see Tegaderm is not put in plastic. I just have it slipped in the side pouch in the Black Hawk Medic roll. And you know, I'm not going to put this kit back together as we go. It's too much work and it'll take too much time. So I'm just going to take it apart as we go. Then I'll put it back together after I'm done filming. So it was back here. Along with that was a non-adherent dressing. This is an old technology. I've used this many times. All it is a Vaseline impregnated bandage. This one's called an oil emulsion non-adherent dressing. It's made by Medline. I got this one at Stat Medical. These are expensive. I know you keep hearing me that, but I'm like, when I got the price for these, I was like, are you freaking kidding me? They're expensive. Why? There's nothing to them. Now, could you make your own? Well, yeah, I guess, if you want to go through the hassle, but it's going to be nasty and it's not going to be sterile. This is a sterile wound dressing, you know, and it's packaged really nicely too. It kind of strikes me as also Mylar. Why would we need this? Use a non-adherent dressing, especially a quality one like this that's impregnated with a Vaseline or some type of substance where it won't adhere to the granulation tissue, because if you don't, you're just going to rip it up when you do a dressing exchange. You with me? So what I will do is when I get a gnarly cut and I'm dressing it, I'm going to stop the blood by direct pressure. Again, I don't want to get into a lot of first aid philosophy, but I kind of have to a little bit to explain the application of materials. I'm going to use direct pressure, maybe elevate the limb above the heart, and see if I can stop the blood loss that way. 99% of the time I've been successful doing that. Once the blood loss is stopped, then I'm going to progress into wound cleansing. I'll do that with some saline. Yes, if it's a minor one, even hydrogen peroxide. I know there's a lot of controversy about hydrogen peroxide. It damages tissue more than it helps it. I still include it because it's better than nothing. And I have some other ways to cleanse a wound as well. And I'll break into that right now. And that is, this is a Johnson & Johnson antiseptic wound rinse that it's called. And the bottle is down here somewhere. So many things. Here it is. Antiseptic wash. I'm sorry, not Johnson & Johnson. Band-Aid brand. I bought this at Walmart. This is not, I don't consider this a deep wound cleansing. In fact, it probably says as much. It's kind of a minor wound cleansing. Kind of deviating, but that is another option for cleaning the wound. Once that's done, wound's cleansed, and if there were some foreign objects in there, I'll dig them out, prep it. Now we're into the area of healing. And I'm assuming that we don't have any arterial bleeding or something really life-threatening that we need to take care of. If we're doing that, then we're going to get our hands dirty and medic style, and we're going to go in as best we can and find where the bleeder is and stop it. But once we're to a dressing portion, which is generally most of the time, that's where these come into play. I'll throw one of these non-adherent bandages down, then I'll put on top of it maybe a topper or sponge, then I'll tape it down. Now that's prior to the Tegaderm technology. Nowadays I have that as an option. You know, my next option that I'm faced with it, I may say, do I go traditional or do I go Tegaderm? Honestly, I'm going to try Tegaderm, see how it does. And that's, again, assuming that I've stopped the bleeding. With me? Cool. Moving on. So non-adherent dressings, I highly recommend you include some of these for traditional wound bandaging. If you don't, when you take that dressing off, you know, 24 to 36 hours later, the guy or gal that you've put it on is going to be screaming bloody murder because you're going to be ripping tissue off. Been there, done it, seen it. What if you're really poor and you don't have money for this? Surgit Pad. I mean, stocking your kit with Surgit Pad. Dude, go with some Kotex, you know, some, I don't know, feminine hygiene products. Here's an example right here. And I don't even know what brand this is. Yeah, I do. It's Equate. I got it at Walmart. And this is this is a feminine napkin, for lack of a better word. No, they're not sterile. But look at the capability to sorb blood. I don't mean to get graphic either. You girls watching, I seriously am not trying to do that. But what I'm trying to show is that there's some other options to stop blood loss. And I will guarantee you, well, I won't guarantee you, but even though it's not sterile, if you keep this thing closed up, it probably won't be an issue for you introducing germs and bacteria into the wound with this alone. I really don't think so. And look how thick that is. That's as thick as a Surgit Pad, so it's going to absorb as much blood as a Surgit Pad, and it's very compact. Here you see one in a plastic bag. This is something I want to water protect. Why? Because it's a freaking sponge. If this goes dunking in the stream, it's going to absorb water, then it's worthless to me. I have to keep it dry. So you'll see the application of various baggies in the kit, and the ones I use that I got at a local craft store are called baguettes, and these are miniature baggies that are relatively high quality. They're as thick as I could find, and you will see I will use those. I have various sizes. I have the 3x5 inch, the 2x3 inch, and I will sprinkle those throughout the medical kit as necessary. And so, yeah, that tampon or whatever the heck it's called, yeah, I got to keep that sucker dry. And I keep them. Even though I have sterile pads, again, I said to myself, on this side pouch, I've got some room. And in that room, I'm going to go ahead and jam in a couple tampons for extra blood stopping capability. With me? I'm jamming it in every nook and cranny I can fit it in. On to tape. You know, years ago, it was very common to use a tape like this. And we're talking, this is basically a wound closure tape. We could use it for that, kind of like butterflies or Steri-strips. Or more generally and more often, we'll use our medical or our first aid tip to dress the wound, apply the bandage, just like I've told you. This is one that was used, you know, fairly common, and this is kind of a waterproof, athletic type, glossy tape. I don't like it. It does not breathe, and so therefore it doesn't ride in my level 2 kit. You know, and then you have some, here's the real athletic tape. This is in my home first aid kit for wrapping of ankles or whatever might be twisted, and it does, like you sports guys out there know, it works. It works great. And then Allie the watchdog is busy down there. And then here's some Johnson & Johnson paper tape. I've used this for years with great success. The reason I like the paper tape or this kind, and this is the NextCare brand, and NextCare is a subdivision of 3M, I think, tape. It's called Flexible Clear, is because it's permeable. So it breathes. It allows the vapor to go through and allows your skin to breathe. This waterproof tape, not so much. You know, athletic tape, same problem. So I like the Flexible Clear. It comes in a lot of different brands and names, kind of like micro sport tape, and that's what I have. Notice I don't take the dispenser with me. Okay, it's too big, too bulky. It does not fit, takes up room that I need in my level 2. So I have one roll. That's been sufficient as long as I replenish my kit after I'm done. Again, I don't have unlimited space, unlimited weight. What's this over here? large roll of dressing. So this would be a good way to wrap maybe an arm, a leg that has some gashes on it once I've stopped the bleeding. Again, I would probably use a non-adherent dressing. Oh, by the way, I forgot to tell you what I call these. I call these adaptics. These things here. So I'd put an adaptic on it and then wrap it. Not too tight. You don't want to cut that blood flow off. It's just going to go slightly firm is what I call it. Around the arm, the leg, and that's another way. I usually will opt for an in-place dressing. Now with Tegaderm, in other words, I'll just tape it. It'll be a localized dressing on the wound. Then I'll tape it up like that. However, some wounds might be around the circumference of the limb. And so a single in-place dressing may not work. This might be more effective. And plus, it's thick and absorbent, i.e. it'll take in a lot of blood. Another reason I have it in. That brings us to our ACE bandages. Okay, and these are traditional, I think they're ACE brand bandages, and they're old school ones. No surprises there. You've seen them. I think this is a 6-inch one. This is a 4-inch one. I go bigger rather than smaller. I don't go with the little tiny ACE bandages because generally if I'm breaking these out, there's been a dislocation, maybe a break. Okay, and or maybe just something with a joint of some sort, and I like the width of this one. So let's say I have a knee injury on the trail. This would be my #1 way of treating it. And stabilizing it, getting it warmer, and maybe giving some compression to the injury site. I like it. There are different types of ACE bandages. One of them you've seen wrapped with some of my guns that I've had tested here at the Nutnfancy project, like Camoform. Camoform is a wrapping material used to camouflage guns and knives. You've seen it. I've talked about it. And this is a roll of it right here. It's nothing more than a camouflage pattern of the newer style of ACE bandage, which adheres to itself. You guys have probably seen this, especially if you've had a break and the doctor has used it. And it's a very nice material. I like it. You can see holes through it. You see that air? So the air through it means it's going to breathe as well. So this is another option. However, for me to fit this type in here wasn't fitting. So right now I'm just going with a traditional ACE bandage, and I'm happy with that. I don't think there's any disadvantages. So other than the clips, don't lose your clips, and if they are lost, I have some safety pins as well. This brings us to section 3 of the kit. How do I want to number them? Oh, what's this? Well, if you guys have watched a review on this, you'll know that it is a Rescue 5 cutter by Benchmade. And it is designed to cut through cloth, boots, leather, anything you need to get off a victim. This thing will rock. Benchmade used to have a video out there showing the demo on this rescue cutter, and you can look that up. I'm sure it's out there somewhere. It's amazing how it cuts. I have tested it myself, and I can vouch that it zips through that stuff. If I had a compound fracture I needed to get to really quick, or maybe an injury of some other sort, and I had to get access through clothing, and I've made the determination that the destruction of such clothing is necessary for wound treatment, this thing is going to come with. And it's so lightweight, what is it, 1.8 ounces to carry with, and it's in the flexible desert tan pouch, coyote brown. The rescue cutter comes with in my level 2. Not always. Not always. Sometimes if I'm backpacking deep, I will make the option of saying, you know what, rescue cutter's not coming, and I'm going to slim down some ounces by pitching it. But look how tiny that is. Look for its own review. You'll see it there in annotation if I remember it. Rescue Cutter 5. They make a 7 one that's bigger. Not needed. The 5 cuts just as good as the 7, and it's smaller and more compact. In here we have a finger splint. Used. That's right. I've used this one before, and I'm reusing it. Why? Because it still works. There's no need for me to rebuy it if it still works. And it's not super critical that it's sterile. I can wipe it off with an alcohol pad if it was. So that goes in there. Oh, more blood sponges. Here's some 3x3 sponges. And let me talk to the labeling for real quick. You'll see that a lot of things will be labeled in my medical kit, my level 2. Why is that? Well, you know what? I'll tell you why that is in part 3 because I am already out of time. We'll pick it up and I'm going to talk about labeling, and then we're going to go on through all the other stuff. Nutnfancy's level 2 medical kit. Thanks for tuning in. I don't even know what time I'm at, but I know I'm out of time. Tune in for 3. See you soon.
I pull my blue jeans on. I pull my blue jeans on.